Yes, sir.
And welcome back to 12 News at Noon. As you know, a heart attack is a life-threatening emergency, and it can occur when blood going to the heart is blocked. These blockages can be caused when the plaque builds up in the arteries, and you have a piece of it break off, causing a blood clot, and that cuts off oxygen to the heart. But today we have Dr. Timothy Quinn with us. He's going to tell us what warning signs we need to be on the lookout for. Dr. Quinn, it's good to see you again.
Hey, it's good to be here, and I'm so happy to have the opportunity to interview with you today, my old friend, Mr. Walt Grayson, sir.
It's been a while. Dr. Quinn, exactly what is a heart attack and what causes them?
Well, a heart attack is exactly what you said in the introduction. It's a reduction or a loss or a total cutoff of blood supply to a part of the heart where that section of the heart is not getting oxygenated blood, and that part of the heart could actually die, those actual cells. It can result in a great deal of what's called chest pain or chest discomfort. It could be misdiagnosed depending on the person. Sometimes the presentation can be different. Maybe the person becomes very dizzy, lightheaded, maybe shortness of breath, maybe just chest tightness, or actually a stabbing pain. That's why it's so important that we have segments like this to let people know if something doesn't feel right about your body, don't hesitate to contact your medical provider. And if it's severe, go ahead and get it checked out, either in an emergency room or if you can go see your medical provider. But if it's very severe, don't try to drive, just call 911, because what you don't want to do is get in a car and have an accident on the way to be evaluated.
Dr. Quinn, how does a person know if they're having a heart attack as opposed to just having, bad sausage for breakfast or something like that?
Right. Well, what I was saying earlier is there's no way you can really know unless you go to the doctor or the emergency room and they do some additional testing to include something called an EKG along with blood work to make a diagnosis that's very high as suspicion. And then they would probably do something called a cardiac cath, where they would look at the coronary blood vessels that are going to the heart to determine if you are indeed having a heart attack. But the most important thing is don't delay getting checked out. Don't just assume it's okay, because in some cases you could have a small heart attack and you ignore it, and then a couple of days later you have, like, I don't know if anybody knows about Fred Sanford, Sanford and Son from the 1970s. I'm telling our age now. He talks about the big one. And that can happen if you ignore the smaller heart attacks. If you have a follow-up heart attack, it could be the big one that can take your life or either cause your heart to go into heart failure where you'll have chronic heart disease.
Yes, that's my favorite part of Sanford and Son is Elizabeth. This is the big one. I think it was. Dr. Quinn, thank you so much. So don't ignore chest pains. Don't just to say, oh, this is nothing. Get it checked out.
Get it checked out, sir. That is correct. Don't have the big one, Elizabeth. I'm coming to join you. You don't want that.
Thank you, Dr. Quinn. Right now, Gracie is the big one. We're coming to join